Hello, good afternoon, all of you. हॅलो. आवाज येतोय का? Hello, good morning, all of you. Good afternoon, all of you. Today we have to continue with the medical adherence. In yesterday lectures, we have to see with the definitions of medical medication adherence means complete follow the whatever the guidance given by the physicians. That is called as medication adherence. Then causes of medication adherence. Yesterday we have to see with this medication adherence and their various causes. Briefly, we have to once again see the medication adherence. That is, the person behavior in taking medications, following a diet, or executing the life changes corresponding to the recommendation given by the healthcare provider. As per the WHO, this is the definitions of medication adherence. Instead of compliance, this adherence is term is preferred for the medication adherence instead of compliance. The impact of medication non-adherence, disease progression is major impact on non-adherence, increase healthcare cost, decrease quality of life, hospital long-term care admissions, patients rate ultimately if medication non-adherence was occurs with that particular patients. And there are some reasons for medication non-adherence. Some patients are intentionally undergo medication non-adherence. The changes are not to use the whatever the treatment given by the physicians. That is intentionally self-decided, and sometimes unintentionally, unplanned, forgot the particular dose during the treatments. These are the unintentionally medication non-adherence occurs. There are some causes also, that is social, economic and related causes, patient related, therapy related, condition related, hair care system related. These are the points we have to discuss in the last lectures. Now we have to move with the next session is role of pharmacist in medication adherence. It is one of the most important parameter healthcare professionals, that is pharmacist, which involves in the medication adherence. The major roles. Generally, pharmacist role is medication and medication of the particular medicament or dispensing the particular medicament. The major role or known functions of the pharmacist is dispensing of the medicament to the patients. Apart from dispensing, pharmacists also involved in the patient's counseling, medication therapy management, disease management, having their important role in the patient's cares, patient's health care specifically. So, this is one of the major factors of pharmacist roles to avoid the non-adherence of the medications. And this pharmacist also link with the social pharmacies, clinical pharmacies, hospital pharmacies also link by this pharmacist. Pharmacists generally work in the pharmacy stores who attach either in hospitals or community pharmacy or clinical pharmacy. All the pharmacists having the key roles in the management of medications to avoid the non-adherence or improving the patient's adherence towards the therapy. Also, the role of pharmacist in pharmacist prescribers and pharmacist patients communications. These are the important parameters to avoid the non-adherence to the particular patients. Means There is a intermediate between the physicians and the patients. Sometimes work as a intermediate pharmacist. So we have to discuss with the pharmacist prescribers during the non-adherence. The pharmacists collaborate with providers, healthcare providers, by setting community settings, ambulatory settings, and hospital settings. With the help of this community ambulatory means OPD patients as well as hospital IPD patients, pharmacist role is important during the medicaments. Whereas the acceptance rate of the particular prescribers at particular hospital pharmacy or community pharmacy are different ones. So this is one of the major parameters for the non-adherence acceptance. Whatever the prescriptions prescribed by the particular physicians, the acceptance rate towards the pharmacy stores are vary, and due to that, the ultimately the patient's cares are not taken properly. Generally, pharmacists in OPD as well as high PD patients, the medication recommendations generally 70 to 90% are received through the pharmacist. Complete almost 90% acceptance rate by physicians for OPD as well as IPD patients. Generally, this hospital pharmacy are involved to maintain the medications non-adherence. Whereas we have to go with the community pharmacy, near about the acceptance rate with community pharmacy by the prescribers are very less as compared to the hospital pharmacy. Near about 40 to 60% acceptance rate towards the community pharmacy, and which is recommended by the particular physicians. Due to this, we have to avoid the non-adherence through pharmacist. And this community pharmacy also helpful for the monitoring, easy to assess to avoid for avoidation of the non-adherence for the complete medication adherence to the particular patients. This community pharmacy is vital role in that medication non-adherence. They easy to assess the particular patients, direct insight into the prescription history through this pharmacist. Generally, the pharmacist role is to collect the necessary basic informations on the basis of patient's corner. First, identify the patient's corner, patient preferences, explain the treatment options available with that particular medicaments, and involve the patient's decisions related with this basic communication with patients and pharmacist. Second parameter related to the role of the pharmacist is condition specific interventions. One size does not fit to all patients. So there is a adjustment in the timing of the dose or adjustment of the dosage regimens. This was depend on the condition to condition of different patients. Minimize this is the due to the adjustment, there is a chances of minimization of the side effect of concerned medicaments. Provide the support and encouragement for the follow-up treatment for particular patient through pharmacist by conveying the support and encouragement related to the particular diseases for their follow-up to the particular physicians. In particular, disease, major conditional disease like cancer, asthma, like our current scenario is corona. In that conditions, pharmacists also intervene during with patients. Third parameter related to the pharmacist role is evaluating adherence. Whatever the for the completing of the adherence, medication adherence, what parameters are involved that evaluated by the pharmacist. Means whatever the problem related to the drugs asked by the pharmacist to the concerned patients, asked specifically about the any dose missed during the treatments. like TB treatment, any dose skip, then you have to continue with the day one treatment. So that type of missed or skipped doses that identify in evaluating of the adherence. Ask about the discontinuation. Why you have to discontinue the particular medicaments by given the physician directions or by yourself you have to discontinue particular medications. Another method for evaluating is pill counting, means tablet countings. Day wise tablets, whatever the tablets consumed by the patients, that tablets or capsules are collectively called as pill counting. This method is uh, you have to measure the adherence or evaluate the adherence. And fourth parameter related to the pharmacist role, that is reminding whatever the instructions given by the physician in the prescriptions, they written in the instruction form to the particular dispensing medications. Like this dose is OD dose at evening time after meal. These type of indications given in the form of written to the particular patient. So to avoid the skipping or missing of the particular dose. Sometimes you have to prepare the pill boxes, means one day dose, Tuesday dose, Wednesday dose. You have to kept and that in that particular pill boxes, and you have to check and remind every times, either in the form of telephonic or emails or WhatsApp. You have to remind to the particular patients. These are the pharmacist rules related to maintain the medication adherence or avoid the non-adherence related to the medications. First is basic communications. Whatever the problems related to the patients, you have to identify and explain the treatments. This is a basic. Then on the basis of conditions, you have to adjust the dosage forms by consulting to the physicians. Follow-up treatments we have to advise during that condition-specific interventions. Means communication is the main role, or patient's counseling is the main role related in the adherence conditions. These are the roles of the pharmacist related to the medication adherence. Second, some methods to measure the measuring adherence. There are 4 5 types of methods you have to adhere the medication adherence. First is direct methods and indirect methods. In direct methods, there are two methods. First is directly observed therapy. This therapy or this method is most accurate one, but sometimes patients can hide the pills, whatever the tablets given by the concerned physicians. That tablet sometimes patients are hiding in their mouth. So this is the drawback with this directly observed therapy. It is the most accurate apart from the other methods for the measuring of medication adherence. Second direct method is measurement of the level of medicines or metabolites in blood. Okay. Whatever the blood reports that can be measured in this direct methods, whether medicaments is available in the blood or not, where we have to count it in the biological lab. This type of testing was carried out. And this type of testing related to the blood samples, these are much more costlier, this method, expensive ones. And to avoid the false impression related to the adherence given by the particular patient, means complete blood reports related to the particular drugs or medicines, how the level of medicines present in the bloods. They are detected by the collection of blood sample of patients and identify accurately. But this method is very expensive methods. So these are the two methods of direct measurement of the medication adherence. And lastly, the indirect method. Here the role of pharmacist is or physician is much more. In indirect method, there are 4 or 5 types of methods. First is patient's questionnaires. Some questions are asked to the particular patients to identify the avoiding of dose or unintentionally skipping of the dose. We have to identify sim- by asking simple question to the particular patient. This method is simple and inexpensive rather than the direct methods, and results are easily find out from the particular patients. That is patient's questionnaire. Second is pill counts, means as per the dosage of every day, TID, BID, they give the pill boxes. You have to identify that particular pill count, pill boxes by asking to the particular patients to show the pill boxes, whatever the tablet capsules required for the particular disease medications, you have to easily identify. Third indirect method is rates of prescription refills. Means how many times particular prescriptions are refilled by the particular pharmacist. It is not directly equivalent to the ingestion of the medications. These are another methods. Assessment. Fourth method is assessment of the patient's clinical response to the particular medications. This method is either maybe does not having accuracy with that methods. There is an inaccurate assessment of the particular medications due to the many reasons during the clinical response to the particular medications. And finally, electronic medication monitoring systems. With the help of media to monitor the medications of particular medications given by the physicians. You have to easily track that particular patterns of taking of drug by the patients. But ultimately, this type of method is expensive ones. These are the some indirect methods to measure the medication adherence. I'll have to take the screenshot of this or direct methods of measurement of medication adherence and indirect methods for the measurement of medication adherence. This type of monitoring with the help of electronic devices. This is one of the example of this last method of indirect measurement of the medication, that is electronic medication monitoring. This is the one of the example is track cap, that is medication event monitoring system, that is track cap. This method is most accurate method for the measurement of medication adherence because what is the reason? With the help of electronics, they measure all the date, times, particular time of the medications, either bottle open or a bottle close at particular times. This type of monitoring was observed by the electronic devices. Also implement the determination of adherence in the clinical practice with the help of dose management softwares. You have to manage or monitor the particular medications. And with the help of this electronic monitoring, you have to easily manipulate it. Patient may remove more than one dosage, open more than once. That type of monitoring was observed by the consent track systems. This monitoring system is very expensive and difficult devices are needed for each medications. Means Every times the different devices are used for the different medications. Due to that, this monitoring system is expensive one, and sometimes there is a chances means this electronic monitoring. Whenever you open the particular cap of the bottles, they counted as a one medication dose. But how many dose they are consumed by the concerned patient, they are not identified. Means there is a some manipulations. Once open and immediately tied the particular cap of bottles. Means it counted as a one, but particular patient does not consume the particular medications. Just for the monitoring purpose, some patients give open the cap of particular bottles and after 5 seconds, 2 seconds, uh, show the acting like consumption of the drugs and once again tied the bottle caps. And whatever the electronic monitoring system, they capture the particular date and time of open and close of the particular cap of bottles and treated as a one medications on particular date and particular times. So this is one of the inaccuracy related with these methods. This last one, that is the equations of medication adherence measures involving in secondary database analysis and pill counts. These are the measures in the left side of the table, and these are the equations. If you consider your, these are the measurements or methods for the measurement of medication adherence. First is medication position ratio, that is MPR, means how many days supply particular medications, days supply as per the medications, means afternoon sessions, morning sessions, evening dose, that supply of the medications you have to observe by this medication position ratio. Means in a one day, how many times you have to supply the particular medica medications, either in the form of interval or give at a time for the daily dose. That can be measured as a medication position ratio. Another measure is continuous multiple interval measures of the medication acquisitions, that is CMA, continuous multiple interval measures of the medication acquisitions. These are the cumulative of the all days supplies obtained over a series of intervals from the beginning of the medications to the end of the time period of the medications. That is acquisitions. There is simple cumulative addition of how many days divided by daily dose. Simple calculations. Another measures continuous multiple interval measures of the medication gaps. Means whatever the gaps you have to identify, that you have to measures. Similarly, continuous single interval measures of medication acquisitions and related with the single dose skipping, that is gap, continuous single interval measures of the medication gap. And finally the pill count. मागे सांगितल्याप्रमाणे पिल बॉक्सेसमध्ये पर्टिक्युलर मेडिकामेंट्स देणे आठवड्याभरासाठी आणि नंतर तो पिल काउंट बॉक्स घेणे, पिल बॉक्सेस सबमिट टू द पर्टिक्युलर towards the physician or pharmacist, and that physicians and pharmacist observes how many doses are remain in that pill boxes. This is one of the major meant of the medication adherence. Lastly, for the completion of unit 2 completely, thank you for the observing the slides of last subunit of unit 2. So today we have to discuss with the various roles of pharmacist related to the medication adherence and various method for the identify the medication adherence, direct as well as indirect. एवढंही लक्षात ठेवलं तर चालेल. हे थोडंसं ऍडिशनल तुम्हाला माहित असण्यासाठी एक एक्झाम्पल घेऊन इलेक्ट्रॉनिक मॉनिटरिंग सिस्टीमचं सांगितलेलं आहे. त्यासोबत काही इक्वेशन्स आहेत ऑन द बेसिस ऑफ सेकंडरी डाटाबेस अनालिसिस वी हॅव टू मेजर द मेडिकेशन adherence. याचा एक स्क्रीनशॉट काढून ठेवा. ठीक आहे. इथपर्यंतचा सिलेबसला सेशनलला सिलेबस असेल. युनिट 1 4 सब युनिट्स, युनिट 2 6 सब युनिट, टोटल 10 सब युनिट्स असतील सेशनलला. म्हणजे कमीत कमी एक MCQ प्रत्येक सब युनिट वर असेल. आणि सेशनल झाल्यानंतर गुगल क्लासरूमला सेकंड असाइनमेंट टाकेल रिलेटेड विथ द युनिट 2. ते सगळ्यांनी सबमिट करायचे. अजून ज्यांनी गुगल क्लासरूमला अजून अटॅच झालेले नाहीत, एनरोल झालेले नाहीत, त्यांनी एनरोल व्हा आणि तिथले जे काही असाइनमेंट असतील ते कम्प्लीट करा. ठीक आहे. नाउ आय हॅव टू कन्क्लूड द टुडेज सेशन्स. उद्या बघूया थर्ड टॉपिक सुरू करूया युनिट 3 चा. ठीक आहे.